Tell me your zip code, I will tell you your life expectancy. And that's because place matters in health.
We have about 23 million people in this country that live in food deserts.
Cheap fast food is the norm in terms of a meal.
You can go for miles and not be able to buy an apple.
Having access to fresh fruits and vegetables cuts down on a lot of chronic diseases. Diabetes is less, high blood pressure is less, and even certain cancers. So we have to look at the communities that our children live in. My patients are with me 15 minutes, 20 minutes, and then they go back into their world, into their environment. And I need to be sure that that environment can help do what I'm asking them to do.
These communities that we're working with were in a recession before there was a recession.
We are not going to solve their problems. We're not going to bring food to them unless we innovate.
Our innovation is the California Freshworks Fund, which is a public-private partnership loan fund that's intended to finance grocery stores and other forms of healthy food retail and distribution in underserved communities throughout California. It's a desert because there's no food there, but that means there's an opportunity because there's demand and then there's lack of competition.
And so we're looking for any mechanism that has been demonstrated to be effective in bringing healthy foods to communities in a sustainable way.
And in this case, it's the business community and the grocers, it's the philanthropic community, it's investors, it's community institutions.
So it's this really great initiative that allows us to kind of look at all the pieces: food access, food production, and education. Weave all those together to create a much more dynamic and healthy food system.
For a child who lives in a community where there used to be either a liquor store or a vacant lot, and all of a sudden one day they look up and there's a brand new grocery store that's selling fresh fruits and vegetables. Wow, that's new. That's different.
We talk about the grocery store as being sort of that centerpiece of a community. A, their jobs. B, all of a sudden they're exposed to a different kind of product and quality and just an environment that says you matter, that you're important. We've seen with that revitalization of the neighborhoods. There's attention now given to the walkability. People are talking about designing streets, cleaning up neighborhoods. It can be catalytic.
I think in general people just perceive that because you're in lower income communities that the money isn't there. Well, that's just simply not true. People eat everywhere and they have to shop and they need their goods and services. If you service them properly and you treat them properly, they're going to be loyal and they're going to come and spend and do all the things that they need in your store.
Just the fact of saying, this is important to us, we're going to help you. The council office is going to help you. The community wants this to happen. There's a big foundation. It makes a huge difference to a developer because it's both financial and that important piece of bringing a community of support.
What we will be able to provide in this partnership in the fund is really capital that may be more patient so that when these operators come in, they can look at the store, look at the numbers and say, I could still run this store in these communities and still make the money that I need to make. Because you have to give them an opportunity to do something that's going to work for them and work for the community.
A successful grocer is very tied in to the community they serve. It only makes sense that you would draw your employees from your local community.
When there is a win-win like that, when there is an opportunity to serve healthy food and provide jobs, we fall 100% behind that.
Healthy living and healthy eating is a business equation that makes sense, and it does make sense for our retailers.
Healthy communities means that we're connected to our communities, we know our neighbors, and that we have the ability and the choice to work in those communities.
So we're using our investment portfolio to make economic investments, our grants to help people get the job done on the ground, to engage the broader public as well as communities to address the issue of access to fresh food, which is a major public health challenge in so many underserved and disinvested communities.
The endowment did realize, let's bring in as many diverse partners into this and let's get something done. And they're getting something done.